Hello, I am Dr. Rekha, fertility consultant, Rekha Sagar Fertility Center and IVF Center, Lakshmi Narayana Hospital, Karimnagar. Today, we will discuss about the fallopian tube blockage causes and treatment. Whenever the infertility couple comes to us with some infertility problems, we do check her menstrual cycle regularity, and then when we come to the part of the tubes, if there is any blockage which we see, then they are labeled as fallopian tube blockage. So how do we detect it? Basically, when they come for the treatment, in the first 3 months, we try to see only their ovulation part. If ovulation part is normal and they don't get success, then we try to think about the tubal part. So if the tubes are blocked, we try to see in histosalpingogram, which is an X-ray depiction of the tubes, where a dye is injected into the uterine cavity and we take a X-ray and see about the fallopian tube openings and patency. If they are blocked, then we label them as fallopian tube blockage. What are the causes for it? Basically, the most important cause in our part of India is PID, which is also called as pelvic inflammatory disease, which is usually infection. Maybe the patient usually knows about it, or sometimes unknowingly they have so many of infections that cause the blockage of the tube. So this basically patient comes with the white discharge and at the end may land up with infertility. And in these, even the tubes get swollen with water, which they are called as hydrosalpinx. The second cause may be endometriosis, which also is now becoming rampant. What is endometriosis? Endometriosis means there is a collection of chocolate material on the ovaries, which can cause adhesion all over the pelvic part, including the tubes, and may cause mechanical damage to the tubes, causing the blockage. The other cause may be surgeries. Many times we have seen that the patients may have some ovarian surgeries. So the many times when they go for the surgery, there is every chance that we handle the tube along with the ovary. So when they are handled, it may end up with adhesions to the tube, and this may result in the damage as well as mechanical block to the fallopian tube. The other cause may be ectopic pregnancy. 1% of the pregnancies end up in ectopic pregnancy, where the pregnancy is there in the fallopian part and it doesn't enter into the cavity. At that time, the patient present in the early pregnancy with acute abdominal pain, where we scan and detect the ectopic pregnancy, and there we have to take up for an emergency surgery, and sometimes we have to remove the tube for the patient, and there becomes a block to the tube. And the other causes which may be mechanical as well as causing something sometimes regarding the infection. So these are all the causes sometimes resulting in it. Sometimes tubal surgery also, when patients go for the direct tubal surgeries like salpingectomy, or sometimes for the when they complete their family, we go for the tubal resection. So this also leads to the blockage. So coming to the treatment part. So how do you come to treatment part? When you come to the tubal tubectomy part, when the patient already voluntarily goes for the tubectomy after completing their family, and then they land up with some loss of the child, then we advise them to go for the tubal recanalization depending upon the part of the tube which is there, or they can directly go to IVF. If it is a part of hydrosalpinx, usually there is a damage to the inner lining of the tube. So they have to go for the resection of the tube. And if you go for endometriosis, it's a long procedure where the patient has to go through a long cycles of the treatment, and she may end up in having IUI or IVF. So I think this fallopian tube is very much needed in the fertility. As soon as you get detected that there is a blockage of the tube, you should get treated as early as possible to have your fertility success.